going to be quite a quick video today, just because there isn't really much to say, or there isn't really much change or anything. Nothing interesting has really happened, so I mean, you might be able to see a change visually if we look back at the videos afterwards, but at the moment there isn't really much to say. Just probably just little things that maybe, I don't know if it'd be helpful to people how I feel about this, but just little things like you might find if you get this done, that where obviously you've got blood in your nose, if I concentrate I can breathe very slightly out my noses, but obviously where I feel that with blood it's quite hard, but it just feels like the way I can describe it is it feels like you've got a cold where your nose is dripping and you want to kind of sniff it back up, or you want to blow your nose. You can't. It's that horrible kind of sensation. If I keep doing that thinking that it's dribbling when it's not, it's just, it feels like it. So I don't know if that's just my experience, but it's really annoying feeling, because you want to like blow your nose but you can't. It's driving me crazy. The only other thing is just I've been a bit kind of worried about washing my hair the past few days, just because where the tape is on your forehead and it's attached there, if you kind of, obviously if I brush my hair, which I've struggled with and I was quite delicate with when I was doing it, obviously you don't notice it when you normally brush your hair, but it pulls your skin slightly, but because it's pulling your skin there, obviously it's echoing, so it's pulling there, so it is quite sensitive to brush your hair, and it takes a while to do it, because you're trying to be as delicate as possible so you don't actually hurt yourself. So I'm going to attempt to wash my hair tomorrow and see how that goes. I can imagine it being a really long process though, just because like scrubbing your hair, obviously that makes your face move and your skin, so I can imagine it being a bit painful, but I'll just have to take it slow and just see how it goes. So hopefully it won't be that bad an experience, but we'll see. And I'm sure I'll feel like really good after that, just because I've been wanting to wash my hair. It always feels nice when you have like a good scrub. So then I'm all like kind of nice and ready to have my stitches out on Thursday. I just can't wait to have that done. The only, like I said, I don't know if I did mention this yesterday, but the only bit that's really kind of annoying at the moment is just the stitches in the septum, the middle bit. I mean, it feels the parts around my nostrils, they just feel normal now. Like, it's not hurting, I can't really feel the stitch, it doesn't feel tight where the stitches are or anything. It's not really sensitive, so those must have been the first ones to heal, because it feels healed, it feels normal, but the bit in the middle, it feels hard. I don't know if that's just where it's taped and like pulled up, or where it's swollen, but it feels quite solid, just down the middle. And where the stitches are, they're quite sensitive, but then your septum is normally quite a delicate, sensitive place anyway. If you pinch it beforehand, it'll make your eyes water like crazy because it is really sensitive. So having stitches out, I can imagine that's understandable why it is a bit uncomfortable. So that's all I've really got to say, to be honest. Oh, the other thing that's really annoying is typical. You get an itch underneath where the cast is, and I can't scratch it. It's so annoying, especially when you get like an itch right there, or like at the moment I've got one like right underneath, just above my nostril, which is fine, and I can scratch it, but I can't reach it, and it's driving me crazy. So just, if you've ever had a cast in your arm before, I haven't, but I can imagine this being the frustration that you get normally. So they're all the frills you've got to look forward to, not being able to scratch or itch. So yeah, I'll get back to you tomorrow, day 6 of recovery. Almost near the day of getting my stitches out. So it's going okay. It's not too long. I think it's just because I'm indoors I'm getting a bit bored, but I definitely get a collection of films and stuff ready before you actually have this done. So while you're recovering, you've got stuff to do. Like, just get a load of stuff that you don't think, because you will use it in the end. Like, get books, get TV series, get films, get everything just to keep you entertained, because you get very bored. And the weather hasn't been very great, so it's not like I can kind of just sit outside and get some fresh air, because it's been raining all the time, so that's not exactly a nice thing either. So yeah, I think that's about it really. Finished my antibiotics today, last course of antibiotics. So I'm pretty much done with all the drugs. I mean, today's the last day. I'll be using the ointment on the wounds of the nose, which I think is an antibiotic ointment. And I've only got one of the I can't think of what they're called. I can't see the whole word because it's kind of been ripped up. Prednisolone. Anyway, it's meant to be for like reducing swelling. So my last one of those, and that's it. That's all my my drugs done. So that's it. It's just a case of kind of getting it off and just letting it do its natural thing, and the swelling going away. It'd be really funny to hear my voice after this actually, because I can tell I sound different, because like obviously I sound nasally where like I can't breathe through my nose, and my lips are quite dry, so it's hard to talk sometimes. So it must sound a bit funny. So I'm sorry about that. I'm sorry I can't speak very loud, because it kind of, as you move, it just kind of pulls your nose, so it's a bit annoying. But yeah, so I'll get back to you tomorrow with my hair washing experience, and hopefully it'll be good news instead of a bad, annoying experience. So wish me luck with that, and I'll let you know how I get on. So see you on day 6 of recovery.